Thanks CCSN for having me. And good morning and good afternoon, everyone. And thanks for joining us. I wanted to talk today just a little bit about my journey, which wasn't little by any way, shape, or form. A little bit about the Save Your Skin Foundation. And really relevant to the title that you see in front of you is how we hope to help cancer patients move into the next generation. And because it's Melanoma Awareness Month, I thought it was really important that we leave you with a few sun safety tips and talk to you a little bit about, just being sun safe. I know if I had done this presentation last week, it kind of might have been irrelevant to everybody because the weather's been so bad. But I hear the sun is shining in the Ontario area. I definitely know it's shining here in BC, so it's time to get the sunscreen out into the glove compartment of your cars and get ready for the summer. So without any further ado, I will move into my first slide, which, Chad, it's not letting me move to. Sorry.
Give me 2 seconds here. I'll just change presenter.
Yeah, you let me be the boss, Chad. Sorry. Okay. There we go. When I do my presentation, for a lot of you that might be on that have heard a little bit about my journey, I do it in the waterfall plot for a lot of reasons. When I first started talking about my journey, I did it at a lot of medical events, a melanoma, cancer, different presentations. So I wanted to do it in some shape that kind of really reflected what the journey was like from a patient's perspective. And if you notice all those long dips, I made those longer or shorter depending on the side effects and what it was really like to have those treatments. So I had noticed a couple lumps on my left arm back in 2002, went to my GP 3 times that year, only be told it was fatty tissue. By 2003, I had 2 lumps. They were turning a little purple. We went in, had them removed for biopsy. Came back, the first one was benign, so they decided to take out the second one. They took out the second one, then I got the call that I needed to go see my GP. I'll never forget, it was Mother's Day, just before Mother's Day of 2003, went alone. My GP told me I needed to go home and get my affairs in order, that I had metastatic malignant melanoma, and I needed to talk to my family. I have to tell you, the wheels fell off our bus right in that moment. I went home. Within 15 minutes, I was in for a chest x-ray. Within 24 hours, I was sitting in front of an oncologist in North Vancouver who told me there was good news and bad news. The bad news was I had malignant melanoma. The good news is because it had moved into my lymph system, the treatment that I was going to need would be covered by BC. So within 3 days, I went for high-dose interferon, which was really the only drug available at that time for melanoma. I got 5 doses, and then I had to inject myself 3 times a week for 365 days. It was the longest 365 days of my life. I'm pretty competitive, so I wanted to make sure I got it all in. I know by the spring of 2004, I went in to see my doctor just before Mother's Day, and I think maybe I had 2 weeks left. And I said to him, please, can I stop now? I had no hair, well, very little hair. I barely got out of bed. I had dropped probably 20 pounds, and I just wanted it to be over. He said, nope, off you go. You've only got a couple weeks left. Finish it up because, this is all you've got, and we want to make sure it works for you. So I completed the interferon Mother's Day of 2004. Thought everything was good, went right back to work. Picked up my life as normal. For those that are, diagnosed with any type of cancer, it's a horrible word to hear, but we put our heads down, we fight hard, and we move forward. The unfortunate part for me is at the end of 2004, I thought that was over, that I'd never have to say or hear the word cancer again. So really just got back into what I called my normal life, not knowing that normal would never be part of my life anymore. In the January of 2005, I went in for my routine chest x-ray. Nothing showed. By the March again of 2005, I started to wisp. I went in to have another chest x-ray only to find a 9-centimeter mass in my left lung. We weren't sure what we were going to do at that point because really, again, back then there was nothing in the pipeline for melanoma. There was a dacarbazine, which is a chemotherapy that either worked or didn't work. So the first thing my doctor did is send me to a lung surgeon. Found out that the mass was in between all 4 quadrants, so the whole lung was going to have to come out. Went back to my oncologist. He said, "You're too young for that." I was 47, 48 at the time. He said, "I don't want to take your lung out if we can do something else. So let's try the dacarbazine. We'll give you 3 rounds. We should know by then whether it worked or didn't." So I had my 2 rounds of dacarbazine. It wasn't working. The day before the 3rd round, I went in for my consult with my doctor, and when we were sitting in his office and he was telling us it wasn't working, my older son that had been doing a lot of research on melanoma asked him about a drug called Proleukin that he had researched from the US, and he had actually talked to the doctor in the US. And my doctor said, "Let me see, come back tomorrow for your last round of chemo, and we'll take it from there." I showed up on the Wednesday for my 3rd round of dacarbazine, only to be told to go home, get in the plane, fly to Edmonton, Alberta. There might be a chance for me to get the Proleukin or the IL-2 there. So my husband left on the plane. Off we got to the Cross Cancer in Edmonton, Alberta. We sat with a research nurse and an oncologist there. I was told that the Proleukin, they could bring it in. The side effects were incredibly harsh. It was going to cost me $40,000. I could either get it in Edmonton, Alberta, because I'd need 24-hour care with my own nurse, or I could go to Maryland in the US and get it for free as part of a clinical trial. And they'd also pick up the cost of travel for us as a family. After seeing the side effect management profile on the Proleukin, I thought, yeah, no, this is going to be pretty hard. There are some incredibly severe side effects, and I wanted to make sure I was as close to home if anything happened to me, because there had been people die in clinical trial on this drug, and I needed to be as close to my family as I could be. The IL-2 was a really intense drug. I had to have it for a week. On, a week off, then I got a 2-month break, and then back again for a week off, week on. It was one of those treatments that your own body only really decided if you could withstand it and keep going on the treatment. There had been 5 before me. 4 hadn't completed, so I was the first one in. I started having side effects right within the first week. The nurses out at the nurses station bet that I probably wouldn't make it through 3 treatments. Well, for anybody who knows me out there, you can't say that to Kathy, because that made me more determined than ever to get as many doses as I could. I started naming the first week of treatments after people in my family, because I knew if I missed anybody, I might be in trouble. In that first week, I got through, I think, 16 bags. They were every 6 or 8 hours. Honestly, it seems like forever ago, so I can't remember. I do know before every bag, though, I was given 10 different pills an hour before to sort of get my body ready for what was going to happen during the injection. It was a very intense week, but I got those bags in. I went home, had a break for a week, went back, and when I had gone, before I had left the previous week, I had a chest x-ray. When I went back for the second week, they pulled up the chest x-ray, and lo and behold, my lung tumor had already shrunk in half. They had never seen such a quick response. My doctor in Edmonton actually called Dr. Rosenberg out of the US, who was one of the first oncologists, I think, that worked in the IL-2, Proleukin. And so we were pretty excited. We thought, wow, that's pretty good. So I completed all 4 weeks. The second week, I think I got 9 bags in. My body really started having trouble. The 2 months was a nice break for me. I continued, with my life. In that 2 months, I golfed. I did my regular sports. That drug seemed to clear out of me as quickly as it had come in. When I went back for the second 2 weeks, it was a little harder. I think by the last week, I maybe got 4 or 5 rounds in, if that. I know I code blued a couple times. I got really, really sick, and we decided that, that was enough. My body was saying enough. And off I went back to BC and thought, okay, this is yet another new normal. I decided at that time I didn't want to go back to work. I needed to do something different with my life because now my new normal life was completely different. In 2006, we started the foundation. because we knew already that I had been given 3 to 6 months, and I had already made 3 years. So I was really still, to me, a survivor, whether it was 6 months, 18 months, or luckily for me, 3 years, I still wanted to be called a survivor. Unfortunately, as everything was getting ready to launch the foundation, we found another 9-centimeter mass in my small bowel. We went in and surgically removed it. Now there's the even bigger question. Can't have interferon. We knew the dacarbazine didn't work. The IL-2 seemed to have given me a response, but the side effects were like horrific. Did I want to go back and re-challenge that? And I have to tell you, if I had to have made that decision, I don't really know if I could have done that. I guess I might have if that's all I had, but it was the side effects of that were so intense, I really don't think my body could have withstood it. So anyway, went in, had the surgery. At that time in 2006, I was asked to speak at the Canadian Melanoma Conference, at which my oncologist from Edmonton followed me out and said, look, we've got a couple of clinical trials that are coming on these new immuno-oncologies. You qualify, and we would like you to consider coming on to a clinical trial. I said, do I really need any more drugs? Because I've had quite a few. Quite clearly, you know, they're not all working. He convinced me it was a good thing for me. And of course, because it was clinical trial, you know, I'd have to pay my expenses back and forth, but the drug would be paid. So I guess it seemed like a no-brainer to everybody around me. And off I went to Edmonton, Alberta, for the first round of ipilimumab, or Yervoy as we call it. As part of the clinical trial, I would get 4 rounds. Then I'd go on a maintenance program. I got my 4 rounds in. Being part of the very original clinical trial, I was given a scan shortly after the 4 rounds. They noticed that a kidney tumor that I had way back in 2003 were starting to grow very, very, very slowly. But back in those days, we didn't know much about IO or immuno-oncology. We didn't know a lot about, you know, progression before regression. So I had another surgery to remove the kidney, which was done in 2009. And I have been absolutely clear and disease-free since. Unfortunately, with the kidney tumor, it knocked me off the maintenance portion of the clinical trial, but that seemed to be okay for me. I was a little worried about the immuno-oncology or the Yervoy treatment because I got absolutely no side effects. I literally would fly to Edmonton in the morning, scooch over to the Cross, get a 90-minute infusion, you know, scooch back to a shuttle and be in the airport and back home by noon. So I was really, really worried because I had none of the side effects from the side effect profile, which to me just made me nervous that maybe it wasn't going to work. So again, going back, I call it the flat line up top, and I'd like to extend this slide because it's, you know, doctors don't like me to say flat line, but as you can see, since 2009 to, you know, look at its, May 18th, 2017, I've been incredibly lucky. And so unbelievably fortunate. And a lot of doctors used to look at this slide and say, Kathy, may just possibility be where we move to the next generation for cancer patients, because we don't know if it was 1, we don't know if it was 2 of our treatments, we don't know if it's a combination. And, you know, even back then they were saying, you know, maybe combination is something we need to look at. And now when I start talking to you about where we are in cancer, you can see that now really combinations are, you know, where we're looking for in the future. So that's my journey. I'm pretty excited. I got it done as quick as I could because, you know, it wasn't a short, sweet journey. My family has been affected forever. We always will be. Last week was my doctor's appointment. You know, it makes me a little nervous going in. I need to go have some CAT scans in the next couple weeks, which makes me incredibly nervous, even though I feel great. I know most of us melanoma patients would say the hardest thing about having melanoma is we never felt sick. You know, and for some of us, we really didn't even feel sick during the treatment. So, you know, it's a little bit of an odd cancer. It was a rare cancer in 2003, but it's a whole different place now. Oh, Chad, it's still not letting me switch. I'm sorry. If you can switch the slide, that'd be great. There we go. So when I was diagnosed and given 6 months, and I went to my first melanoma conference, I went alone, which was a big mistake because I didn't understand anything they were talking about. I was still in this survival curve, and it made me incredibly sad to think that really for melanoma now, there was really only, if you were lucky, a 20-month extension to your life. Now, that being said, too, I mean, 20 months, doesn't seem like long. But what I realized very quickly is even when I was told I had 3 to 6 months, I would look back, and I would urge you all to look back over the last 6 months and think about the things that you have been able to see or do, and would you have given them up? So to me, it got to be where, this didn't affect me as much because I knew if I could just hop, step, and jump, that hopefully I would get to the treatment that would be my magic bullet. Now, I hope that's my Yervoy. I truly do. I hope that's the magic bullet for me. It was a hard process to get to that. It might not be the end, but I do know what I have been able to see over the last 6 months, I wouldn't give up for anything. Most of us have seen birthdays, grandchildren born, children being married. 6 months doesn't seem like long, but when it's all you're going to get, it seems like an eternity. But the future of melanoma drastically changed back in 2010, 2011. I always say it was almost like we were at the back of the bus. And now I almost feel like we're driving the bus. And I should apologize. I just noticed a spelling mistake up top, so I'll blame that on my chemo brain. But now you can see that curve is extending. We're looking now at 120 months. Now again, this curve is starting to make me a little nervous because I'm at that end of that curve. I'm already at the 120 months. And every time I go to a conference and one of the doctors puts this up, I keep saying, please start extending that because I still need to see some hope. And I still need to see that there are other patients that are surviving longer than I am, so that, I have something to at least use as my milestone and move towards. So that's what we're looking at now in melanoma. And it's for a lot of reasons. And I want to talk a little bit about that. Sorry, Chad, won't let me change again.
I'm not sure why it's doing that. Well,
Here I am. Okay, so our Save Your Skin Foundation. We started it back in 2006. And really, it was because we knew as a family how lucky we had been to get where we even were. And we wanted to give other melanoma patients at least some hope. So in those beginning years, because you saw my curve, there were very few drugs available. And we started really trying to raise money when patients came to us to move them to the centers they needed to get to. So Proleukin and IL-2 was really only being administered in a couple centers across Canada. And so every time a patient came to us, we would raise funds, we would try to connect them to that center of excellence, and we would start paying for their flights, their accommodation, whatever we could financially and emotionally to help that patient get to that journey. So that is really where it all started. Where it's gone has been quite incredible. I never could have believed it would have gone this far. And you have to remember, as a family, when we started this foundation, we weren't even sure if I would even get to see the first year of it. So the Save Your Skin is a national not-for-profit organization, and we're dedicated to skin cancer and skin disease, with a focus on education awareness, supporting research, and ensuring equal and timely access to treatments for all Canadians. Again, it was started in 2006 by myself and my family while I was still battling. And even to this day, no matter where we go and how we change and how big we get, we will always be dedicated to those touched by the disease. When patients call us, we will respond within 24 hours, and that's a guarantee. It doesn't matter where I am, what telephone service. I know when I was diagnosed, there was absolutely nothing. I went online, even though they told me not to. I couldn't find anybody to talk to. I couldn't find a survivor. I couldn't find a support group. I couldn't even find up-to-date stats. I could find nothing. And I needed something. I needed somebody somewhere to throw me a lifeline, and it wasn't available. So at our foundation, we guarantee that if patients come to us, we will help them from beginning to wherever the end leads us, and they have us whenever they need us. So the main objectives of the foundation were to provide emotional and financial assistance to those battling melanoma, to promote education awareness of skin cancer and the risks and prevention. Then it started to be a lot to work with government and health professionals to advocate equal timely access, because we started to see new treatments for all Canadians. We work with key stakeholders to help ensure provincially and federally consistent healthcare. We help to encourage and facilitate knowledge transfer between Canadian physicians and the global melanoma community. And we play an integral part in the Canadian healthcare system by helping to navigate patients and family physicians. We've had a lot of milestones over the last 10 years. We launched the first ever melanoma survivorship program called I'm Living Proof. We held the first melanoma survivor meetings in the East and in the West, invited patients to share their journey, to discuss the unmet needs that they felt were around melanoma, and to really talk about survivorship and what that meant to them. And really, we wanted to define what survivorship meant to us. We all had this vision, or we all do, of what survivorship means in cancer. But is that really the way it is today? And we wanted to talk about value and quality of life and truly what it meant to us. Everywhere we go, we hear about statistics and research and data, but we wanted to talk about us and the value that we bring, because we truly feel we are the real life data. We are the data that people need to know and to hear about. So since we launched the I'm Living Proof, we've actually launched a few other survivor campaigns. Not just skin cancer was one, Melanoma Through My Lens was another one, Melanoma Through My Lens, I'm sorry. And both of the campaigns were to start shedding light on the challenges and the fears, but also to start providing hope and to start talking about survivorship in melanoma. Because as these new treatments were coming forward, everybody was talking about the cost. We wanted them to see the value added that we bring when we get these treatments and when they're available to us. So we started producing public service announcements. We started doing webinar series. We held patient information sessions across the country. We hosted webinar support groups. We started meeting right across the country with provincial health ministers. We started working with other advocacy groups. We really wanted to play an integral part in the healthcare system by helping navigate the patients and start educating everybody about these new and innovative treatments that we were starting to see come forward in melanoma. And I think we knew it was only going to be about a matter of time before we started seeing these treatments come into cancer indications. And we needed to get ready. We really knew we needed to get ready. So we have about 45 website visits per month. A lot of people spend, 2 to 3 minutes on our Facebook, or on our website. So as many of you know, that's pretty good. We have over 1,400 Facebook followers. We have 1,900 Twitter followers. We have 100 newsletter subscribers, and we have hundreds of patients on our database. And that excites me. When we did our first P-coder submission, because we are able as an organization to submit patient input through the process, when we did our first P-coder way back in 2011 and 12, when we saw the first targeted and Immuno-Oncology, we had 15 patient inputs. 5 of them were patients, the other 45 were from caregivers, because we had lost that many patients. Our last P-coder submission had over 200 patients that actually were able to give us input. That to me tells a story. It's not the greatest story. We know we lose over 1,200 patients to melanoma a year, so that's a small fraction. Whether there's patients out there we don't know about, who haven't heard about us, that could be one thing, but we do know that the landscape and the survivorship and quality of life is absolutely at a different place than it was. So in 2015, we thought, how do we help everybody in melanoma, with melanoma, or in advocacy, now that we are driving the bus? So we started a group, and we called it the Immuno Oncology Network. And we invited a group of leaders in patient advocacy to come together to discuss the need for a network focused on immuno-oncology with a mandate that was dedicated to ensuring access to these important therapies to cancer patients in Canada. Since then, started 2015, this network of patient advocates has already been involved in addressing issues within the system, at the government level, and in HTA, both related to immuno-oncology and targeted therapies. With this in mind, the network has now decided that we need to reevaluate our priorities beyond immuno-oncology and use the leadership involved within the network to bridge the gap that currently exists now within the system and to help bring solutions to the table. We know it is more imperative than ever. In 2017, this network of patient organizations will operate now with a revised strategy that addresses immuno-oncologies, but as well as other innovative therapies. There is an ever-increasing need to focus more broadly on cancer and the barriers that exist for cancer patients and how we can work as a group to provide solutions for better cancer care that translate to improved patient outcomes. We must work together to find solutions that lead to improved processes in the system that can sustain these new effective and expensive drugs. These new expensive drugs are expected to become one of the cornerstones of cancer treatment in the years to come. But despite the breakthrough potential, numerous hurdles need to be overcome to ensure patients have adequate access to appropriate treatments. And we have seen and still are seeing the hurdles in the melanoma realm. Some of the challenges facing these new drugs are, of course, the cost, when and how they are used, side effects, how these should be managed, the need for companion diagnostics, general lack of understanding among patients, physicians, and the general public on how these new treatments work and how they fit within the current treatment paradigm. And we found this especially in melanoma. Most doctors would say to us, we were trained in chemotherapy. Chemotherapy is what we know. This is new. It scares us. We look at the side effect management profile. That makes us nervous. So we knew in those beginning days that we need to educate, educate, educate. So the vision of the network was really a world where all people living in Canada get equal and timely access to safe, effective treatments that improve patient outcomes free of barriers. What we found in the first years in those melanomas, when we were trying to move patients, that you can actually live or die sometimes in this country via your postal code. And that just seems so unethical to us. Our mandate is if the patient groups working together to promote greater education and understanding of therapies to ensure that Canadians have equal, timely access to these companion diagnostics, these therapies, and the support care that they now need as we start talking about survivorship. So our objectives were to raise awareness of cancer therapies and educate on the value to patients, to healthcare systems, to HCPs, to increase commitment to cancer care at the provincial and national levels. We wanted to foster collaboration between patient groups, the medical community, to meet the changing needs of clinicians and patients in this rapidly evolving environment. We meet the evolution of the healthcare system in Canada to optimally support cancer patients in the advanced and metastatic setting. We want to inform and consult with governments, bureaucrats, decision makers on the value of cancer therapies. And most of all, we want to support patients' access to appropriate cancer therapies. We understand the costs, we understand the hurdles, but we are now talking about innovative medicines. We need innovative solutions, and we now need to work together where we get to that place. Our audience is a network, our oncology patient advocacy groups, federal and provincial and territorial governments and bureaucrats, including CADA, the governing bodies, medical community and professional organizations, patients and especially their loved ones, and the general public and the media. We need people to start hearing about these treatments and seeing the successes of these treatments. You know, we just did our regimen submission to PCODER, and we did a survey monkey. And it was really fascinating to read and see the data. And we actually asked PCODER if we could not only, you know, do our submission, but if we could send them the real feedback that we had gotten from the patients on that regimen. And these were patients that it so far has worked for. Some of the patients had to quit because of the side effects. Some of the patients didn't even get to the regimen, but we went and asked for their feedback anyways, because we really need people to know what value of life and quality of life is worth to us, and what we as the patient are willing to go through and be part of, to be part of a solution. We hope for survivorship, but even if we don't think we'll get to that place, we really do want to be part of the changing face of treatments for Canadians. So it was really interesting to see. I think what we captured most of all is patients on these new regimen and these new treatments have a different quality of life than patients that we have seen in chemotherapy. And you know, this is not, I'm not a scientist, I'm not a doctor, this is just the data we hear from patients. These patients would drop their kids off at school, go have their 90-minute infusion, go back to work, pick up their kids after school, go make dinner, take them to ball practice, take them to ballet. They still had a good life, even throughout the treatments. So that to us is starting to even to tell a story about what value needs to look like and how we need to start dividing or defining value. Every time we speak, everywhere we go, and start talking about value, the first thing we see and hear is a dollar sign. We would like to kind of expand that a little bit. You know, let's talk to the young mom that was diagnosed, had a reoccurrence when she was 7 months pregnant, and we didn't know if we'd see her or her baby even survive. And now her daughter is in kindergarten. Let's talk to those people, and let's hear the real life data. So that's my speech, but I would not be good if I didn't talk about Melanoma Awareness Month. You know, we talk about how odd skin cancer is. Because it's preventable. It's curable if it gets caught early enough. And hopefully, we're starting to see, but hopefully one day we're going to be able to say, what, survivable? Curable? No, we never want to use that C word, curable, but we do go to the States a lot, and we're hearing that doctors are actually starting to use that word. When I was first asked to say survivor, it kind of made me nervous. I never said I was a survivor. I called myself NED, no evidence of disease, because I was scared I'd jinx me. People ask me now if I feel I'm cured. I'm still a little nervous to use the word because I don't know if I'm cured. I hope so, and I hope one day that, you know, we can use the word cure like we now use the word survivor. But I just want to give you a few stats. And again, I'm going to tell you how even though we've moved a long way since 2003 when I was diagnosed, I urge you to all still go online and, you know, pull up a little bit about melanoma or skin cancer in general, and you'll still find that, you know, we're still even not where we need to be. I tried to find data. It's really hard to find data on skin cancer. It's estimated, this is 2015 data, 78,000 Canadians will be diagnosed with non-melanoma skin cancer. So basal cell, squamous cell, actinic keratosis. Over 44,000 of those will be men. Over 34,000 will be women. Actually, 500 people estimated in 2015 will die of non-melanoma skin cancer. We all know that melanoma is the deadliest form of skin cancer. It's estimated from 2016 that we'll have 6,800 new cases of melanoma. 3,700 will be male, 3,100 will be female, and that 1,200 will die from melanoma. Again, I think with skin cancer, what we do know is 90% of it is from UV exposure. If melanoma can be caught early, it can be curable, and the survival rate of that can be good. So with melanoma, education and awareness, again, with skin cancer, is very, very important. So we urge everybody this weekend, remember, you can have fun out there in the sun. Yes, you need vitamin D, but it doesn't have to be 8 hours of continuous UV exposure. Limiting your time in the sun between 11 and 4. Planning any of your outdoor activities in shaded areas. Remember that sunscreen. Wearing protective clothing, hats, and sunglasses. We are seeing lots and lots of oral melanoma of the eyes, uveal. It's really important that you put your sunglasses on. Get the sunscreen that you like. Check the label. It should have UVA, UVB. You can go on to the Canadian Dermatology website. They have great information on sunscreens. They even have a sheet on there that will tell you if they approve it or not. Make sure it's waterproof. Make sure you put that sunscreen on before you go outside. It's relevant to put it on after your skin has burnt, because when your skin starts to change color, it is telling you to cover it up. So I want to end by saying, remember, no tan is a safe tan. Your skin is the largest organ in your body. You see it every day, or your loved one, or your parents, or your children. Check your skin regularly, and your loved one's skin. If you see something that doesn't look right, see your physician and get it checked. I like to say, love the skin, protect the skin, and save your skin. Because I can honestly tell you, I wanted to change the color of my skin, and it will never change, and it almost killed me. And if there's anything I can do to protect anybody from the journey that my family and I have had to go through since 2003, I will. So thank you, everybody. Thanks again, Chad, for having me. And if you want to open up to questions, that'd be great.